Welcome to my channel, The Fit Hub. I am telling about whooping cough, also known as pertussis, is a highly contagious bacterial infection of the respiratory tract caused by the bacterium Bordetella pertussis. It gets its name from the whooping sound that often occurs when a person gasps for air after a severe coughing fit. Key symptoms: severe hacking cough that comes in fits, paroxysms. A whooping sound when inhaling after a coughing fit, more common in children. Runny nose, fever, and sneezing in the early stages. Vomiting after coughing. Exhaustion after coughing spells. How it spreads. Pertussis spreads through respiratory droplets when an infected person coughs or sneezes. It's extremely contagious, especially in the early stages, before the cough becomes severe. Stages: catarrhal stage, 1 to 2 weeks. Cold-like symptoms, mild cough, low fever. Paroxysmal stage, 1 to 6 weeks. Severe coughing fits, possible whoop, vomiting, fatigue. Convalescent stage, weeks to months. Gradual recovery, but coughing may linger. Who's at risk? Infants under 1 year old, especially those too young to be fully vaccinated. Unvaccinated children and adults. Older adults or people with weakened immune systems. Complications: pneumonia, seizures. Brain damage, rare but serious, especially in babies. Death, mainly in infants. Prevention: DTaP vaccine for children, 5-dose series starting at 2 months. Tdap booster for preteens, teens, and adults. Pregnant women should get a Tdap vaccine during each pregnancy to pass immunity to the baby. Treatment: antibiotics, like azithromycin, can help reduce the severity and prevent spreading if given early, supportive care. Hydration, rest, managing cough symptoms. Hospitalization may be needed for infants or severe cases PLZ-like. And subscribe my channel. Thanks.